My name is Alice Lenahan, and I am Vice President of Women on the Wall. Now that Governor Abbott and the Texas legislature has passed and signed into law Senate Bill 11, HB 18, along with Senate Bill 504, the framework is in place for federal funding for programs in schools implementing social and emotional learning, behavioral wraparound services. In my packet to you, I've included a testimony in opposition to those mental health bills because I believe that it is relative and that it's important for you to understand the pushback against social emotional learning from parents across Texas. I have a question for you. Do parents and our elected officials realize the psychological data collected along with the interventions and assessments by charter schools as well as public schools, but specifically these charter schools with ties outside the United States, means that these people, whether their intention is good or bad, can use social, emotional, psychological data collected to modify Texas children's values, beliefs, and behaviors. Is that what Texas parents send our kids to school for? As I have said and will continue to say, the fundamental shift in education today is away from an education of opportunity, equal opportunity based on academics, reading, writing, math, and history, to an education of equity, equal outcomes based on attitudes, values, beliefs, and behaviors. And the question becomes whose values, beliefs, and behaviors? When education is focused on how students perceive the world, this is known as critical theory or cultural Marxism. As noted in the Pioneer study, SEL will further erode the fundamental rights of parents to control the education and upbringing of their children due to an unjustified expansion of the schools beyond their basic mission of academics. Thank you.
I've been the Director of Social and Emotional Learning for the Austin Independent School District for the past 3 years. Prior to my current position, I was a campus administrator for 24 years and a teacher of 10 years. Austin ISD has worked closely with CASEL, the Collaborative of Academic, Social, and Emotional Learning, for the past 8 years. As Ms. Conley just mentioned, our district is considered one of the national leaders in social and emotional learning. Millions of dollars of public and private investment has assisted us in our successful initiative across all of our 130 schools. From my research, personal experience, in conversations with other districts around the nation who have been implementing social and emotional learning for years, the goal of integrating social and emotional learning into academics, especially STEM, is typically the most challenging and final step in a social and emotional learning initiative. Despite employing 12 social and emotional learning coaches who interface regularly with 2 SEL champions from each of our campuses, our district is still working to master integration of SEL into our curricula. That's not a failure, but a recognition that social and emotional learning integration into academics takes years of staff training and planning.
Good afternoon, Chairman Thompson and members. My name is Wayne Sneed. I'm the Mental Health Supervisor for Austin ISD Police Department. I've served for nearly 37 years as a police officer. I've been a mental health supervisor within this department for 6 years. And during that time, we have 130 campuses that cover about a 235 square mile area of the city. I'm here testifying in favor of House Bill 10. This bill will help address 2 troubling trends that appear to be occurring amongst our students. Our school counselors are faced with daily crisis incidents that demands most of their time, which does not allow them to serve the students who have merely academic needs. The calls range from severe mental health crisis to completed suicide on our campus during school time. Suicidal ideations and other severe mental health issues among our youth appear to be increasing, and we're seeing this on the ground. For example, last year, 2017-2018 school year, suicidal ideations within our district were 878. Attempted suicides, 378. Non-suicidal self-injury, our cutters, 1,689. CPS referrals for mental health related issues, 875. Intensive counseling sessions, 4,815. Completed suicides, 6. This year, from August to mid-December 2018, our counselors and our staff have handled 1,300 suicidal ideations, 72 suicide attempts, 749 non-suicidal self-injury incidents, 875 CPS referrals related to mental health, intensive counseling sessions, 1,000. Age that this begins, the way we begin to experience our mental health crisis is drastically